Hey, Care Partners. Welcome back to Memory Care with Teresa Youngstrom. So glad you're here. Hope you're having a great week. And we've done it again with another amazing guest speaker for you today. So get your notepads out. I think you're going to take a lot of great notes. And honestly, it's taken a long time to get him on the show. So let me tell you about Dr. Timothy Sigwart. A graduate of the University of Notre Dame, later completed his doctorate in clinical psychology in 1994 at St. Louis University. Since being licensed as a psychologist in 1995, he's worked primarily with older adults. In 2003, he helped found and directed the Centers for Interactive Geriatric Assessment, where he provided geriatric and neuropsychological assessments. In 2016, he formed with his partner, Dr. Babu Gupta, the NeuroPsych Center of Greater Cincinnati. The goal of this center was to provide comprehensive mental health services to older adults. He continues to provide geriatric assessments and neuropsychological evaluations. Specific area of focus or expertise would include the diagnosis of various forms of dementia and cognitive impairment, behavioral management of dementia, issues surrounding competency, and the functional assessment of older adults. Please help me welcome Dr. Timothy Sigwart.
It's great to be here. I'm looking forward to it.
Thank you so much. It's just great to have you here. And I know my audience is going to be thrilled to have someone of your caliber, on and answering so many questions. And so we are just delighted to have you here. Let's get started because time flies when we're having fun. So, what is a neuropsychological evaluation?
A neuropsychological evaluation is an evaluation of brain functioning, assessing cognitive domains, including attention and concentration, expressive and receptive language, visual spatial abilities, typically short-term verbal and nonverbal memory, and what we call executive functioning, which is your ability to plan, organize, and initiate behavior. Neuropsychological testing performed correctly under the right conditions is actually considered a biomarker of brain functioning. So we can use it to track things, make diagnoses, and try to predict things in the future.
Okay. So, why is a neuropsychological evaluation a valuable tool for the assessment of cognitive decline in older adults? And how does that differ from
Um,
a neurological evaluation?
sure. So dementia and mild not neurocognitive disorder are actually what we call functional diagnoses, right? So in other words, the criteria for dementia, although we throw that word around all the time to refer to anyone that has types of memory issues, is actually predominantly based on the functional assessments of cognitive ability, right? So therefore, neuropsychological testing is very central in making such diagnoses, right? So criteria include for like mild neurocognitive disorder, one area of cognitive decline. For dementia, it's two or more plus functional difficulties. So therefore, neuropsychological testing is central to making such diagnoses. Furthermore, neuropsychological testing is the most sensitive way to detect early changes and is one of the best ways to discern between different types of cognitive decline. People always ask the difference between dementia and Alzheimer's.
All
And
right.
so dementia is just a level of cognitive and functional impairment, but neuropsychological testing helps us determine what might be causing the cognitive decline, whether it be Alzheimer's or say cerebrovascular disease or Lewy body dementia. Now, while neuropsychologists look at the brain from a functional perspective in terms of how the brain's actually working, neurologists typically look at it from a structural perspective, like with brain
Mm,
looking to see how the brain looks, or
mhm.
physiological perspective with regards to other assessments, including like EEGs, PET scans, or lumbar punctures, among other things. And such more typical neurological assessments can help determine possible pathologies, but they can't easily assess the functional capacity of individuals, right? And so in some ways, you can't really truly diagnose dementia with brain imaging or a PET scan or anything because it doesn't really tell you are they functionally impaired in certain cognitive domains.
Right. Yeah, because I've heard of people who they've done autopsies on, and there's all this tau problem, and yet they didn't seem to have, a dementia or an Alzheimer's. So, yeah,
And
so interesting.
the
Um,
the nun study, right? I'm sure you've heard of the
yes,
you've probably talked about the nun study, right? So
you taught me
the
about the nun study about 4 years ago, just so you know, and I've used it many
so
times. But
yeah.
it's a classic story. Actually, tell them the nun study real quick, just because
Yeah.
that is a great example.
So there's a convent in Minnesota. So a little bit of background, right? Statistically, we expect people at the age of 85 that 50% of us will meet criteria for dementia, which again is two or more major areas of cognitive impairment plus functional difficulties. So they discovered this convent of retired nuns up in Minnesota. And what they discovered was that many of these nuns were in their 90s, some over 100, and very few of them showed signs of dementia. They didn't meet criteria for dementia in a functional way. So these nuns, allowed their brains to be donated to science. And when they would look at their brains after they passed away, they were surprised to find that these nuns all had different pathologies that would have caused dementia in a lot of people. So they had the Alzheimer's signs, neurofibrillary tangles, senile plaques, or they had significant cerebrovascular disease or Lewy bodies, but they never showed the symptoms. And so, really, the concept of what we call cognitive reserve came out of that study because these nuns never really retired. And first off, they were all very well educated. They had very stimulating careers. And then when they retired, they lived in a group. They were very socially active. Many of them physically active. A lot of them continued to volunteer. Obviously, they went to mass regularly. They ate meals together. And as a result, we've figured out that if we keep our brains active and stimulated, that we can essentially hold off the effects of cognitive decline. And so neurologists a lot of times will identify a pathology. In fact, I had a patient who had a lumbar puncture from a neurologist, and they found that she had the remnants of these proteins, amyloid and tau, in her cerebrospinal fluid. And when she showed the neurologist said, "You have Alzheimer's," and she said, "Well, how long do I have?" And he said, "10 years." Right. And she was devastated, right? So she came for me to a second opinion, and we evaluated her, and she was like an accountant. She was a CPA. She's still doing people's taxes, right? And her profile was average to above average. And I was like, okay, listen, yeah, we've identified that maybe there's that Alzheimer's pathology, but there's a chance it may never show, right? And in
Yeah.
fact, if you continue to do all the things that you're doing and keeping your brain active and stimulated, that can be very helpful in terms of preventing or perhaps slowing it down. So I encourage her. I said, "Hey, go live your life, keep your brain active and stimulated, and then we'll just check in once a year, right? We'll do the tests and we'll see if there's any changes." And in years since then, her brain's actually gotten better.
Oh my gosh. I
I was
love that
surprised.
story. Yeah, the nun, it
The
makes me
nun
think they needed purpose, or we need purpose. That's what I believe is we
Mhm,
all need purpose.
absolutely.
And
Mhm.
I've seen people with that scenario of they retire and then they die, and it's like, oh,
Right. Oh, yeah, yeah. Because then
you see
these
too
like
much of
yeah.
that. We've definitely okay, so thanks for sharing the nun story. I think it was really good and pertinent. Okay, beyond helping to determine the nature of the cognitive difficulties, the diagnosis, what else can you tell from neuropsychological evaluation?
Sure. So while neuropsychological evaluations, as I said before, are very helpful in establishing a specific diagnosis, especially as it pertains to whether or not someone presents with cognitive or functional impairment sufficient to warrant the diagnosis of dementia. And again, I'm a stickler with that because again, you people, if you're over the age of 65 and you have a memory issue and you present at a medical facility, there's a 90% chance you're going to be diagnosed with dementia because they don't really understand what it is. And like you said, that's kind of a game changer. It's like you walk around with that diagnosis and you think, oh, I have nowhere to go from here. But but the neuropsychological evaluation, helps us establish the diagnosis. But they're also very helpful in answering the more functional questions that are
Mhm.
often more important for families. I mean, they want to know the diagnosis, but the questions they have are things like, you know, can the individual continue to live independently, right? Can they still drive an automobile? Can they still manage their finances? Can they still stay at home alone? Are they able to make decisions related to their health, their finances, their disposition? And in some ways, the evaluations help determine what's the most appropriate level of care in terms of assisted living or living at home with help and assistance. The results of brain imaging, blood tests, lumbar punctures, all those other typical neurological assessments are not able to answer those functional questions. So I think the neuropsychological evaluation is very well suited to provide a more comprehensive picture and help families, guide families as to what they need to do to help their loved ones.
I love that. I'd like to take a minute and welcome anybody who has joined us late. This is Dr. Timothy Sigward, our guest today, and he is with the NeuroPsych Center, Greater Cincinnati. And gosh, I'm glad you tuned in, but you're going to want to go back and take it from the beginning. There's a wealth of information being shared today. Our next question: are there behavioral things people can do to prevent or slow down cognitive decline? This is the $1 million question.
Well, again, kind of going back to the nun study, right? That's kind of where we establish a lot of these research findings. But research suggests that there are modifiable lifestyle variables that can prevent, slow down, and in some cases even improve cognitive functioning for individuals with exhibiting cognitive decline. Now, of course, I don't tell people to count on the improvement, but it does happen from occasion. So these interventions, in just a general sense, include more regular cognitive stimulation, focusing on novelty, challenge, and variety. Right. So if we do a variety of different tasks, we're using more of our brain. If the activities are challenging, it's like we're working the brain out. It's stronger, and so therefore it's less likely to decline. And then if they're novel tasks, right? So if you're doing something that maybe you always wanted to do but never got a chance to do it, what that can do is stimulate what we call neuroplasticity, which is your brain's natural ability to reorganize, heal itself, learn new things. And in these cases, sometimes we can actually see reverse aging of the brain. Now, typically with people with cognitive decline, that's less likely, but for folks that are, in their, middle ages, kind of where we are, that if we do that, it can actually, instead of our brain being, 60 years old, it's a brain of a 57-year-old. And because that new activity sprouts all these connections throughout the brain. So again, increase cognitive stimulation, increase opportunities for social activities, and what I'm really talking about is conversation, right? Because I'm
Mhm.
somewhat, I believe it or not, kind of an introvert. I'm not really big into groups of people, but I have a lot of more one-on-one conversations, and it's really that conversation that's very stimulating to your brain. And we have all sorts of research suggesting that people who are more socially involved or involved in conversation is that it's a prophylactic has a prophylactic effect on cognitive decline. Um, Probably, in my estimation, the best thing we can do for our brain is regular moderate aerobic exercise.
Love
All
it.
right. And so
Mhm.
moderate aerobic exercise is anything that we do that increases our heart rate to 50 to 60% of what's recommended for our age, which is essentially what we do when we normally walk. All right. But
Mhm.
it doesn't have to be walking. It could be, treadmill, exercise bike, elliptical. I have a little under the desk elliptical that I pedal when I write reports. And I usually bring that out for people that watch television a lot because unfortunately TV doesn't count as a stimulating
That's
activity.
right.
But if they pedal while they're watching, well, now it's stimulating.
Okay.
So we
Okay.
we have a huge study of people with mild neurocognitive disorder, and what they found is that those who engaged in 40 to 50 minutes of moderate aerobic exercise 4 or 5 days a week can significantly slow down cognitive decline, and in some cases show improvement. Although I don't tell people to count on it.
Mhm.
Why is exercise so good for your brain? Well, it does three things. First, it promotes what's called neurogenesis, the production of new neurons in your brain, especially in your memory center. It also promotes angiogenesis, which is the production of new arteries and veins in your brain, which combats cerebrovascular disease. And then the third thing it does is it promotes a natural chemical that's responsible for what we talked about before, neuroplasticity, which is your brain's natural ability to reorganize, heal itself, learn new things. Other things that we can modify that can help our brains have to do with diet, especially using what we call the Mediterranean diet, green leafy vegetables, lean meats like chicken and fish, nuts and berries, healthy oils like olive oil versus vegetable oil. Stress management is very important for maintaining and brain health, and especially the use of mindfulness exercises. And there's a lot of research on the use of mindfulness exercises. It's good for stress management, but also we find that with regular use, it actually makes your frontal lobe thicker and increases your executive functioning by 10 to 15%. Your frontal lobe and executive functioning is typically the first part of our brain as we get older to start to decline. Other things that are really good for your brain: sleep hygiene, okay,
Mhm.
getting a good night's sleep. And there's a lot of things that go into that in terms of helping improving your sleep hygiene. But we're finding out more and more that sleep is so important for cleaning out the clutter in the brain, but also helping to consolidate memories and actually for more flexible thinking, creativity. Um, and then, more specifically, we also, recommend there's certain cognitive training platforms. The one we recommend the most is called Brain HQ, which again has some independent research supporting that using that more specific cognitive training can prevent later cognitive decline. Um, so all of these behavioral interventions are typically presented during my feedback session, as appropriate with a neuropsych eval. But we also try to help educate people, like doing things like this, and implement them as part of our other programming within the Neuropsych Center.
Love that. Wasn't there a time where we thought, you had as many neurons as you were gonna have and they didn't? And is that newer,
Yeah,
research
yeah, you're
that
right.
okay, I thought so. That's incredible, and it's
Yeah, we
great.
yeah, yeah.
Yeah,
So
we
and
got
and so we can improve our connections, but yeah, so we that neurogenesis is a real thing, and for whatever reason, moderate aerobic exercise seems to be something that enhances that.
okay, good. Yes, do your yoga. Let's see. Um, what other services are available for older adults dealing with cognitive decline at your center?
Yeah, yeah. So as you mentioned, one of the primary missions of the Neuropsych Center of Greater Cincinnati was to provide comprehensive mental health services to older adults. So this includes obviously neuropsychological and what I call geriatric assessments because it's a little bit broader than just focusing on the neuropsych. But we also provide outpatient counseling and psychotherapy for older adults with or without cognitive decline. We have a lot of services focusing on caregiver support and counseling. We have opportunities for like behavioral consultations. We have, something like what you do, but you are doing it at a much more intense and educated level than what we do. But in terms of people dealing with problematic behaviors, and then we have psychiatric services with practitioners who have training and experience dealing with older adults and cognitive decline. And then our more recently developed Healthy Brains and Dementia Support Complete programs. Um, that and these are programs that we've just recently developed to start helping provide additional support to families going through the dementia process.
Yeah, is there more information about that, about the dementia support program to share?
Yeah, yeah.
I think a
Um,
lot of my
so the
listeners are gonna be interested in that.
so the Dementia Support Complete program is based on a chronic care management program that's typically been utilized by primary care doctors for diagnoses including diabetes, congestive heart failure, and other chronic health diagnoses. So I kind of came up with the idea. One of the diagnoses that's listed as a chronic diagnosis is dementia.
Mm,
And so what we decided to do is develop this specific program to address issues related to the dementia diagnosis. The program was designed to provide ongoing support and resources to individuals diagnosed with dementia and their families. The program involves periodic check ins with a nurse practitioner who assesses their functioning and needs and tries to help them develop a care plan, which
mm,
includes goals for maintaining cognitive and functional capacity. And then afterwards, they're assigned what's called a care manager who checks in with the patient and family at least monthly to assess needs and assist in making
nice.
progress towards these established goals. The care manager also is available for as needed consultations regarding more acute needs, for the patient or the caregiver. As part of the program, the patient has priority access to a lot of the other support services and professionals in our service to address functional, psychological, psychiatric, and behavioral needs as necessary. The nice thing is that the program is typically covered by insurance, and that the patients and families have the option, but the patients' families do have the option of discontinuing it at any time. And so I think with the exception of one insurance at this point is covering it. And then, if I can expand a little bit on that.
Sure.
Um, so uh, CMS Medicare has just developed a new program called the Guide Program. All right. And as of the beginning of this week, we're
Mhm.
allowed to and are excited to announce that we are. Um, so we've been selected by Medicare to participate in the Guide Program. And so we're one of 400 sites selected across the country to administer this program. And the Guide Program is for individuals with traditional Medicare who have diagnoses of dementia. So it doesn't cover everybody, but our other program covers the other insurances. Essentially, the goal of the program is almost identical to what we've already established. Somebody must have, told them what we were doing. And so,
Mhm.
but in terms of all the services available, in terms of the ongoing support and whatnot, developing a game plan, we would do that as part of the Guide Program. But the one additional benefit for the Guide Program is that recipients um, can have access of up to $2,500 worth of respite services per year to
Mm.
provide additional support for caregivers. So that could include um, non-medical companionship services, adult day programs, or even respite stays in assisted living or care facilities. And so even though we're able to announce it today, we will not we can't start enrolling folks for about another year. But
Okay,
we
another
were very
year.
excited to get to be selected as one of those programs, and it's really again kind of just fits real well in with our dementia support program.
Yeah.
Yeah.
Congratulations. I think that's
Congratulations.
huge.
Yeah, thank you. We're excited.
Yeah, and I really appreciate your program, where you have care managers out helping these families. Some of these families are just like, we don't know what to do. We don't know what to do next. They're driving me crazy, and I don't know what to do. It's very interesting. I tell them, we learn how to take care of a child very slowly. They sleep a lot, right? You feed them, you change them, they sleep a lot, but this is an adult who's suddenly having challenges, and we have no training, and we're midlife and find ourselves stranded with no training, and we're trying to wing it. And so frequently that ends up in a disaster or an emergency room visit. And so I'm just so thankful to have people like you out there to send my folks to when they need someone to do some great testing and tell them what's still working and what they need to, what their challenge, where their challenges are, and then what to expect in that dimension. You know, I think folks are definitely going to want to know how to get a hold of you. So if you can give us
Mhm.
some information, how would someone listening today, how do they get a hold of you? How can they follow you somewhere? How can they contact the office for information?
Sure. So we're located in the Cincinnati area in Sharonville, which is just kind of north of Cincinnati, right off of 275. Our office phone number is 513 We do have a website that has all of our services there are available right there. It's the Cincinnati Geriatric Psych.com, all one word. And so all of our services are listed on there and our providers, contact information. Um, and so that's probably the best way to get in contact with me. Unfortunately, uh, and it's not just me; it's a lot of neuropsychologists. We are booking out pretty far. I typically would book out maybe 2 months, maybe 3 months at most. But actually, within the last year, I'm booking out more than a year and 3 months now. My theory behind that is that it was probably due to the pandemic, and why I say that is I was consulting in retirement communities and assisted living, and I was still able to see a lot of my patients there while the pandemic was occurring, and so I had very sharp, very bright, very high functioning individuals who were attending all the activities and all that stuff, and then all of a sudden they were isolated in their rooms. They couldn't even eat meals with other residents. They couldn't go to activities. They weren't seeing their families. And literally week after week, you could just see them decline.
Suffered
Um,
significant decline. I had the same problem. It was so sad.
mhm, yeah. And so, these people, they had these great routines, their brains were active and stimulated, and then all of a sudden for 2 years, they're yanked out of that. So, I mean, these are not only people in facilities, obviously, but people at home.
Mhm.
Um, and then they may not have the executive functioning at that point to really, flexibly come up with, alternatives. And so I feel like if there's anything that was just below the surface, right now it's come out, and now all of a sudden the demand for services has gone way up. But in terms of getting in to see me, when you're booking out a year and 3 months, you do have a lot of cancellations. And so what I recommend is if people, want to get in and see me, they can call in, set up the earliest available appointment, and then just request to be put on our cancellation list. And the cancellation list is kind of a first come, first serve. But when things open up, which they frequently do when you're booking out this far, then our team might will call around, and it's kind of first come, first serve, to see who would be available to take those appointments. And again, sometimes it'll happen. We'll find out at 8 o'clock in the morning that they can't come in, and so they're calling around at 8:30 for a 9 o'clock appointment.
Mhm.
A typical appointment with me, it's a 3 hour block of time, and a lot of times people think, oh my gosh, that's a long time. But it's broken up into, we do kind of an interview, including family members. We then do the testing, and the surprising thing about the testing, and I mean, it even surprises me. I'd say 75-80% of them, even if they're struggling, will say it was fun and interesting.
Mhm.
And I don't quite get that, but it's true. I mean, I guess,
You
we
must be
try to.
fun and interesting, that's all I can
Yeah.
say. That's
Now,
all I can
I
say.
I have somebody who helps me with my testing, so, and then what we'll do afterwards is we'll take about 10-15 minutes to kinda score things up, and then I will actually provide what I call my preliminary feedback on the day of the assessment, so they know verbally what I'm thinking, as well as any recommendations that I might have at that point. We then put it all into a typewritten report with all the recommendations in there. Those go out within 2 to 3 weeks. We'll send a copy to the patient, family, and the referring physician. Um, so that's kind of how the process goes. And like I said, we have lots the other available services as well. The waiting lists aren't quite as long with them.
Gotcha. Well, I'm a
Gotcha.
huge fan,
Well, I'm a huge fan.
and I am forever referring folks to your
Referring.
office, so I'm happy to be a part of making you or keeping you busy. But I just wanna
Well,
thank you so
and
much. No, go ahead.
yeah, with the guide program, we again, one of our nurse practitioners, Amber Whitlatch, she's unbelievable. She's awesome to work with. But in the course of this next year, she's kind of guiding that, but we'll be looking for collaborators and whatnot. And certainly, Teresa, you're top on the list as perhaps someone we would reach out to kind of, um, maybe help us with some of the services that we can provide as part of that program. So,
Absolutely, that sounds like a perfect opportunity for me to come in and serve. Yeah, I'd love that. Well, thanks
okay.
again for being here. Hey, everybody, Dr. Timothy Sigward, NeuroPsych Center, Cincinnati, Ohio. I think this has been amazing, and I'm going to need to listen to it a few times just to grasp all the information. And I hope you've enjoyed this. We really appreciate those of you that are liking and subscribing, and please share this information. There are a lot of people hurting who really don't see the resources or they can't find the resources, but there are resources, and we have a lot of free resources. And we've got Dr. Sigward out there to help you too. So please like, share, subscribe. And as always, remember, you got this.